and welcome to YouTube channel HealthQ, the place where my mission is to motivate you to look at the brighter side of the health. In today's video, I'm going to share with you one of the important information regarding Parkinson's disease. Parkinson's disease, if you identify it early and start acting upon it, you can delay the degeneration or else worsening of the symptoms to a lot of extent. And that's why early identification of the problem is very important. So, what are some early signs of Parkinson's disease? Let's have a look. The first early sign or symptom of Parkinson's disease is tremor. Tremors are nothing but gentle shaking or is involuntary movement of hand. Whenever this tremor are present at rest, this could be a sign of Parkinson's disease. But tremors can also be seen in elderly following an injury or else an overall muscular weakness. And these tremors are predominantly present following movement. Hence, it's very important that the symptom needs to be ruled out from a healthcare professional. The second early sign of Parkinson's disease is small and crowded handwriting. A person who suffers from Parkinson's disease will gradually observe that his handwriting is getting smaller and is getting crowded. This is also an early sign which needs to be ruled out from other conditions as aging, stiffness in finger and vision issues can also lead to similar symptoms. The third early sign of Parkinson's disease, loss of smell. A person who suffers from Parkinson's disease will also gradually observe that his ability to smell some typical food is getting reduced. Trouble in sleeping, insomnia. A person who suffers from Parkinson's disease might get some jerky movements while sleeping, and that's why this leads to disturbance in sleep and could be an early sign of Parkinson's disease. The next early sign of Parkinson's disease is trouble in moving or walking. Yes, the ability of a person to walk in a good speed reduces. The walking becomes very slow and the swinging action of the hand, which is very coordinated action in every human being, also reduces. That's why the person will walk slow. Gradually will see that he walks in a complete block way, which means there wouldn't be a change or a shift or a flexibility in the movement seen while walking. A person with Parkinson's disease also typically have constipation issues. Straining is difficult and also leads to difficulty in passing bowel. The seventh early sign of Parkinson's disease is soft and low voice. The voice of a person will become gradually hoarse and it will become very low in pitch, and that's why the person will start observing that the people surrounding that person will tell that you are not able to speak loudly. This is also a typical characteristic of early sign of Parkinson's disease. Face. The person who suffers from Parkinson's disease gradually loses his ability to do automatic facial expression, which is due to degeneration of the neurons which are present in the brain, due to which the face looks expressionless even when the person is happy. Hence, a person might look sad, depressed or else emotionless even when a person from internally is feeling happy. Feeling dizzy or fainting is also very commonly seen, especially in the early initial stage of Parkinson's disease. This is related to the low blood pressure, which could be because of the degenerative changes that's happening in the brain. The early sign of Parkinson's disease is stooping or hunching. A person who suffers from Parkinson's disease will gradually develop an hunchback posture. This is mostly because of rigidity and muscular stiffness that gradually develops over a period of time. If you or your family members or your friends that you are standing or walking with a hunched back on a gradual level, then it is a sign which needs medical attention. So, these are the 10 early signs of Parkinson's disease. But all the signs that I have mentioned could be present in some or other way in other conditions as well. Yes, as a person, if you are experiencing these signs and symptoms, don't come to a conclusion that you are having Parkinson's disease, because there are other conditions as well which mimics the symptoms of Parkinson's disease, and that's why it's very important that a medical professional helps you in coming up with a conclusion or a diagnosis of Parkinson's disease. Once Parkinson's disease is diagnosed, then only its treatment can be started. Because as I have mentioned in my previous video as well, that most of the management of Parkinson's disease is medical management, which means medicines are a very important part of Parkinson's disease management, and these medicines also come with its own side effects. So if you have identified that you are having any of the symptoms that I have mentioned in this video, what you can do? The first step, definitely you're going to see a doctor. A doctor, especially a neurologist. Neurologists are the doctors who specialize in neuromuscular or movement related disorders. Since Parkinson's disease is a brain related problem, neurologist is the right person who is supposed to help you out in solving this problem. But along with neurologists, you also need to see some other professionals like urologist, physician, physiotherapist, occupational therapist, speech therapist or psychologist. This is all depending on to what extent your Parkinson's disease has been progressed, what is the severity of your symptoms, and what symptoms are more over other. Basis that only the treatment is decided. As I have mentioned in my previous video, the management of Parkinson's disease is a multidisciplinary approach. Since there are a lot of other secondary problems that you might face in Parkinson's disease, that's why you might need to speak to or else interact to different healthcare professionals at different levels for your different problems. With the help of your professionals, you can work on your management goals or else your mobility goals, and you can live a good quality of life. As I previously mentioned, it's very important that you should be realistically optimistic so that you can work towards your problem in a better way and solve these problems. Keeping this point in your mind, I will end this video here and I'll see you in another video. Thank you.